Welcome students. Today I will teach you about the anatomy of spermatic cord. Spermatic cord in itself is a very important question in anatomy as well as in surgery, because that is the structure which has to be saved while doing the surgery of inguinal hernia. Okay, so what is spermatic cord? Spermatic cord is the cord which is traversing the inguinal canal in males. Inguinal canal is the canal present above the medial half of inguinal ligament, and it is extending from deep inguinal ring to the superficial inguinal ring. So this deep inguinal ring, it is connected to it is facing the peritoneal cavity. The superficial inguinal ring, it is towards the skin, it's outside, okay, towards the midline of the body. So the area, the canal which is formed between the deep inguinal ring and superficial inguinal ring is the inguinal canal, and the walls are mainly formed by the fascia or the aponeurosis from the abdominal muscles, transversus abdominis, internal oblique muscle, external oblique muscle. So similarly, these are also going to be protecting the cord, spermatic cord that we are talking about today. So what is the spermatic cord? It is the cord which is traversing the inguinal canal in males. This much you have understood? It is coming from the abdominal cavity and through the deep inguinal ring, it will traverse the inguinal canal, come out of the superficial inguinal ring and reach the testis, or you can say other way round, so as to connect the testis finally to the urethra, because it contains vas deferens or ductus deferens, which is the main content of spermatic cord. So the name itself suggests that it is a cord which is going to transport the sperms, isn't it? So now what are the contents of spermatic cord? This is a very important point. So the contents of spermatic cord, the main important content is the ductus deferens or vas deferens, then the testicular artery, then the artery of vas deferens, or you can also say artery of ductus deferens, and also cremasteric artery, the artery for cremasteric muscles. The cremasteric muscles are present in the scrotum, which produce the wrinkles in the scrotum. So the cremasteric artery, these were the arteries. Then the veins, pampiniform plexus of vein will be there in that spermatic cord. Next, lymphatics. What are the lymphatics? All the lymphatics which are draining the testis, they have to go inside, isn't it? I said that the testis, epididymis, all these are the lymphatics from these organs are drained in pre-aortic and para-aortic lymph nodes. So how will the lymphatics reach the pre-aortic and para-aortic lymph nodes? Because those lymph nodes are present inside the peritoneal cavity. So the lymphatics from these structures which have to reach the pre-aortic and para-aortic lymph node also are the contents of spermatic cord. Nerves, sympathetic nerves which were supplying these organs, they will also be the contents of spermatic cord. Now we should know what are the coverings of spermatic cord. There are three coverings: outer spermatic covering, outer fascia, spermatic, we call it spermatic fascia, outer spermatic fascia, middle and inner. So this fascia is developed from nothing but the fascias of abdominal muscles. So the outer spermatic fascia is coming from the transversus abdominis muscle. So it is also called fascia transversalis. The middle spermatic fascia is coming from the combination of fascia from internal oblique fascia as well as fascia transversalis. The inner spermatic fascia is coming from the fascia of external oblique muscle. So I think you have understood how important this spermatic cord is, and one very important structure that you should not forget, that it is taking the sperms, the veins, the lymphatics to from this testis and epididymis to the peritoneal cavity, isn't it? From there they will reach their destination. It is also bringing the arteries from the peritoneal cavity to these organs which are lying outside the peritoneal cavity, and therefore it is, since it is connected with the peritoneal cavity with the peritoneum, so the peritoneal fold which was forming the tunica vaginalis is also present in the spermatic cord. The tunica vaginalis, which was the outermost layer of testis. So these were the coverings of spermatic cord, contents of spermatic cord, and the position of spermatic cord. And so I think you must have understood not only the anatomy of spermatic cord but also the importance of spermatic cord. Thank you.